All right. How are you guys? Okay. This video I'm going to make now, I did. It's regarding a video. I've made another video, just a brief video for kidney issue. So you guys are going to be wondering, why am I discussing health issues here? Yes, I'm going to discuss health issues here. Like, I have another page that I discuss health issues. Okay, you can. That page is called Managing Diabetics. Managing Diabetics. It's on Facebook, to YouTube, and TikTok. There, I discuss health issues because that is my field. Okay, that is my field. So, if you want to know more about health issues, go to my page. It's called Managing Diabetics. It's on Facebook, TikTok, and YouTube. Discuss. That is my main page. This one here, I'm just following the politics. I'm a student of politics. I also enjoy politics, so I like to contribute what is going back in Nigeria. So that is why I also on this page. But my main page is on Managing Diabetics. Now, why I discuss, I have a lot of kidney videos there. Now, the only reason why I'm doing this video specifically for kidney is because of the video I saw on Facebook with Peter Obi in Enugu when he was visiting some people, some Nigerians that are battling this chronic terminal illness. And the pictures I saw in that gathering was so touching. And I felt so bad. And I said, okay, when I listened to the conversation between the guy and Peter Obi, there are certain things he said, but it's like he misplaced the explanation. He misplaced the explanation, not in order of priorities. Because when I look at that picture several times, and I can categorically separate that particular picture, those group of people there, into three categories. There are people that are they are in the toppest chain of priority that need urgent care attention now, not tomorrow, not to put them on dialysis. They have passed the stage of dialysis. They are on their end stage, and the only way they can come out of that end stage is through transplant. And there are other people that are in the early stages of the kidney disease. Okay, those ones can be on dialysis because they still have time. And we have the middle ones and then the children. Now, when you're talking about kidney disease have 5 stages. So in this particular video, I'm going to discuss fully about stages of kidney disease, and also I'm going to discuss with you guys what are the causes, what are the first signs and symptoms of kidney disease. Now, every human being have 2 kidneys. They are like bean shape. Every human being have 2 kidneys, and they play a very crucial role in our survival. Now, if you have 2 kidneys, you can survive with one. If one is damaged, you can survive. They can remove one and leave one for you. But when both of them are damaged, then you need a transplant. Now, if you are battling kidney disease, you need a specialist, a nephrologist. We call them nephrologists. Kidney disease cannot be. Your doctor is going to give you to the level of his understanding, because your doctor is a general practice. There's a difference between a general practice medicine doctor and a specialist. With the people I saw on that video, they need to be in the care of a specialist, not a general practice doctor. So let's be straight. The people I saw on that particular video, they said about 500, they're supposed to be under the care of a nephrologist. Those people are supposed to take care of them. Now, as I said, the kidneys are 2 bean shaped. Every human being have 2 bean shaped kidney. And the main function of kidney is to filter out extra fluid and waste and toxins from the blood out. So how do we filter them out? Either through the urination or through when we pass feces or sweat. Okay. Now, kidney also has other, when in terms of kidney function, it has the primary function, it has the secondary function. Okay. But the main primary function of kidney is to filter out excess waste, fluid, and toxins from the blood out of your system. So how I do explain kidney is that it's like when you go to an office, the first people you're going to see in an office is a receptionist. And the receptionist want to know why you are here. You say, okay, I'm here to see so person. They ask you, do you have an appointment? You say yes or no. Then the receptionist is going to ask you to wait in the waiting room and then go and notify the person that, oh, there's somebody in the waiting room want to see you. Can I allow the person come in or no? So whatever response you get from the person will decide whether you want to allow the person inside or tell them, no, the person cannot see you today, come another day. That is the same function with kidney. Anything you drink and eat have to go pass through kidney. And kidney have to access those things you are eating, either fluid or solid, and know, are they good for your head and it's going to allow them in? The ones that are bad for your head is going to deny them entry and then they're going to be passed out as a waste. That is the primary function of a kidney. Now, kidney disease occurs when the kidney are damaged due to unable to filter blood properly. When they're unable to filter blood properly, they start having a kidney issue. Okay, this is what gradually causes a buildup of fluid. So when your kidneys start developing issues, they are not able to filter the blood properly, your body start accumulating and building up fluid. The people I saw in that video, you see I saw some of them, you see them have a big stomach, swollen foot, because the kidneys are not more filtering very well, they are not more functioning, and they start building fluid. Okay? And toxins waste in the body. And this can lead to health problems like high blood pressure, okay, heart disease, and even stroke. Okay? Once there's accumulation of fluid in your body, you're not being filtered out, it can cause you to have heart disease, cardiovascular disease, or stroke, or blood pressure. And you wouldn't like that when your kidneys are not functioning. Now, when it comes to an early stage, because the problem I saw in that video again is that he was saying that most of them don't even know how they got it or when it started. And when I look at that painful video, I see some people there that are helpless. In fact, they are in their end stage because of lack of knowledge. And that is why they are in that area. So they don't even know how they got it. Knowledge will help you for survival. Now, there's a previous video that I did. One thing that is peculiar with we Africans or Nigerians in particular is that we don't like to go and see a doctor when we are healthy. We only go to see a doctor when we are sick. That way of thinking have to be changed. You don't need to go and see a doctor when you are sick. You can go and see a doctor when you are healthy. Run a check. We call them annual checkup. There's the importance of doing annual checkup. Even though you are healthy, go and do annual checkup. Spend that money. Annual checkup can find out some certain illnesses that are yet to come, or they notice something that's going to come later, and then you start the treatment now. Okay? Than waiting for it when it has matured and risen to a certain stage that by the time you get to the hospital, it's already too late. You don't have option. The most beneficial reason why you have to do annual checkup, even though when you're healthy, is that there are most or certain disease that you can catch early that is treatable, curable, or you can stop the progression from expanding further. Because at the early stage, you have several options to cure, to stop, or to treat that illness. But when you only go when you are seriously sick. It has metastasized to stage 3, stage 4. By the time you get to the hospital, your options are limited. Then it means you are battling to save your life. That is why it is important to make sure go an annual checkup. Don't wait till when you are sick. When you are healthy, take your family, spend that money, do an annual checkup to make sure you are healthy. You can do it once a year or twice a year. In North America, where we are here, we practice preventive measures. We don't practice curative measures. A country that practices preventive measures spend less in medical expenses than a country that's only practice curative measures. Africa, Nigeria in general, in particular, practice curative measures. They only go to see doctor when they are seriously sick, and by the time they go there, it's already too late. But in North America here, they educate, they make it even sort of mandatory that you have to go and do annual checkup, because prevention is better than cure. Because when they're able to find some certain illnesses early, it is less expensive to cure or to treat that illness than when it has developed to full-blown disease. So that is one thing there, that when they say most of them don't know how to get it. Okay? Because most of them could be due to lifestyle. I'm going to discuss all those things to you, what the causes. So now, in the early stages of kidney disease, it does not cause you any pain or any symptom. You don't have it in the early stages. As I said, it has 5 stages. In the early stages of your kidney disease, it doesn't cause you any symptom. It doesn't exhibit any symptoms. And without symptoms, there's no diagnosis, okay, or any treatment. So kidney disease worsens over time, leading to like foamy urine. So the most visible symptom of kidney disease, when it has started developing to the most serious, maybe from stage 1 to stage 2, going to stage 3, you start seeing foamy urine. That is one thing you guys have to pay attention to. Anytime you are passing urine and your urine is foamy, do not neglect it. It means something is wrong with your kidney. Go and see a doctor. It's telling you something is wrong with your kidney. When you are passing urine and it is foamy, it means there's a leakage of protein into your kidney. There are 3 things I'm going to tell you, my friends, my brothers and sisters in Africa, in Nigeria in particular. Anytime you are peeing and your peeing is foamy, it's a sign that your kidney is having an issue. Go and see a doctor. Most guys I saw in that video will have noticed this foamy urine and they ignore it. And here are they today. It has gone to full-blown chronic kidney disease. At the stage I saw them now, it's called CKD, chronic kidney disease. Most of them will have noticed that foamy urine in the early stages, but they ignore it. And then here are they now. So the symptom you can see when it has started progressing from 1 to 2 is foamy urine. When you see foamy urine, go and see a doctor immediately. Don't ignore it. Second thing is, anytime you are peeing and you see blood in your urine, it's a serious issue. Go and see a doctor. There shouldn't be any time you are peeing and see a blood in your urine. Anytime you see a trace of blood with your naked eye in your urine, it means it has gone to stage 2, stage 3. There are some blood you cannot see with your naked eye when you are peeing, except under microscope. So sometimes you might go for a urine test and doctor come back and say, oh, we'll find some trace of blood in your urine. And you say, but I just peed. I didn't see any blood. No. There are 2 ways. A trace of blood you can see only on microscope. That one is on the early stage. But by the time you start seeing blood with your naked eye, it means it has metastasized. It has gone to advanced stage. So you shouldn't see, anytime you see blood in your urine, go and see a doctor. Or anytime you are going to a pool and you see a trace of blood in your poo, in your stool, in the toilet, anytime you finish pooing, do not flush. Turn back and look at what you put to see if you are going to see any blood. Some people, when they finish pooing, they just flush. No. Anytime you finish pooing, turn and look at your feces there to see if there is any blood. If you see any trace of blood in your feces, it's a problem. Go and see a doctor. All right? Or protein in your urine. So these are things you guys have to know. So in the early stages, you will not see any symptoms, but as it progresses, you start seeing foamy urine. Okay? So that is the symptom you're going to see early. So that is the first symptom you're going to see. When it starts progressing from stage 1 to stage 2, you're going to see foamy urine. Okay? That is one of the earliest symptoms of kidney disease you're going to find. Okay? Because there's a protein that leaks into the urine. And that is what they call proteinuria. Proteinuria is when there's a leakage of protein into the urine. Okay, now the signs of proteinuria include persistent foamy or bubbles in your urine. So anytime you are seeing bubbles in your urine or foaming in your urine, we call them proteinuria, because every time you pee, you're going to see bubbles or foaming urine. We call them proteinuria. Okay, so once you see, I'm just going to be, I don't want to spend too much time. I just want to tell you guys, so those symptoms, and then I'll go to the stages. Now, the second symptom, that is when it has started progressing from foaming urine, is frequent urination at night. Remember, frequent urination at night is different from frequent urination, because in diabetics, it's one of the symptoms of diabetes. When you are frequent urinating in diabetes, one of the symptoms of diabetes is frequent urination. But this one is frequent urination at night. Diabetes is frequent urination, but this one is specifically frequent urination at night. So when you are getting up at night to pee, then know that you have issue with your kidney. There's an excess buildup of fluid that causing you to wake up at night to go and pee frequently. So excessive urination at night, this condition is called nocturia. So remember, when you have leakage of protein in your urine, we call it proteinuria. And when you have peeing a lot, okay, we call them nocturia. So nocturia is when you have excess urination at night. So you keep waking up at night to go and pee because you have excess fluid buildup within yourself. All right. Now we have the swelling of the feet. You see some, because in that video I saw, you see some people, their feet, ankles are swollen. So when the kidneys aren't able to clear extra fluid and waste from the body, you may experience swelling or edema. So swelling or edema in around your feet and ankles. So this may cause your legs, your feet, ankles, and to swollen because your kidneys are not functioning. And then the next symptom is fatigue. Okay, fatigue, feeling tired. Then the next one is itchy skin, bone and joint pain. These are some of the symptoms of signs of early kidney condition. And then the next one is shortness of breath. When it gets to shortness of breath, you are almost to the end, you're almost to the stage 4, stage 5. Because it means your kidney has failed you. So that is a severe symptom of kidney disease, experiencing shortness of breath. We call them, dyspnea. This may occur during physical activities or interference with daily activities. You start having shortness of breath. Now, that is the early symptoms. Then we have advanced symptoms. Okay, the early symptoms, you're going to notice these symptoms in the early stages. But when the kidney has progressed in advanced stage, the symptoms changes. Okay, when it has progressed to more from stage 1, especially from stage 3. From stage 3 is now in advanced stage. Then the symptoms are going to change. And then on this advanced stage, the symptoms are severe. It's life-threatening, like chest pain, dry skin, itchy body, numbness, feeling tired easily, shortness of breath, muscle cramps, worsening swelling, difficult concentrating, loss of appetite. Okay, this sleeping problem, nausea, vomiting, and weight loss. These are the advanced symptoms of kidney disease. Most of these people, they will have seen these symptoms, but they couldn't recognize it. Okay, now, when to see a doctor? As I said, when you start seeing bubbles or foamy urine, it is time to go and see a doctor, or you start losing appetite. When you start losing appetite, or you have swelling of your ankles, your feet, and your hands, you have to go and see a doctor, or shortness of breath, fatigue, or frequent urination at night. These are some of the time you have to go and see your doctor, especially when you start noticing foamy urine or bubbles in your urine. You go and see a doctor. So from that particular video, I noticed all those things, and you could see how the way some of them are sitting, they are tired, they are weak, even most of them cannot even breathe. Because I was assessing that video closely to know what is going on, and I sympathize with their condition. I see some of them. I can count at least 10 people that I need urgent care right now. They need kidney transplant because of the stages of what I saw on that particular video. Now, what causes, this is very important, what causes kidney disease? It could be your lifestyle. Your lifestyle can cause some of this kidney disease. What are the causes of kidney disease? Is high blood pressure. Failure to treat your blood pressure properly can cause you to have kidney disease. Okay, diabetes can cause you to have kidney disease, and that is why if you're a diabetic patient, you have to treat your diabetics. Do not ignore managing your sugar levels. Failure to control your sugar levels, you're going to have complications of kidney, because kidney is one of the complications of diabetics. High cholesterol also can cause you to have kidney disease. Okay, we have the low lipoprotein, LDL, which is the bad cholesterol, low density lipoprotein, and the high density lipoprotein. You have to make sure you get rid of the bad cholesterol and make sure you keep the good cholesterol. We have the LDL, the HDL. Okay. Now, inflammation of the kidneys, you have the inflammation of the kidneys. Okay. Can also cause, it's one of the cause. Or you have an inherited disorder called polycystic. Okay. Polycystic kidney disease. Those are inherited disorder. Or you have blockages in the flow of urine, such as from the kidney stones. Maybe kidney stone is blocking flow of urine. That can cause you to have kidney disease. Or long-term use of certain medications. Certain medications, like when you are using some steroids, okay, or some NSAID medications without confirming from your doctor, can cause a damage to your kidney. So these are some of the causes that can cause you to have kidney problem. Now, I'm trying to rush this video because when I saw that, now, when it comes to kidney treatment or kidney diet, your lifestyle matter, diet changes matter, supplement medications, all these things can be treated depending on what state that it is. Now, I want to go to the stages. As I said, there are 5 stages of diabetics. Okay, there are numbers we look at. There are numbers doctors look at. There are numbers we look at to know if your kidneys are functioning properly. As I said, there are 5 stages of kidney disease, and I can count a lot of people in that video that are in stage 4, stage 5. Now, stage 1, you have a normal to high functioning kidney. So when you have normal to high functioning kidney, your filtration rate, your GFR, is going to be greater than 90 milliliter per minute. Okay? At stage 1, it means you have a normal to high functioning kidney. Your kidney is functioning normal. Your GFR is above 90. So it means it's functioning above 90%. That's excellent. In stage 2, mild decrease in kidney function. It means the GFR is now down below 90, between 60 and 89 milliliter per minute. So 90 is normal function. 60 to 89, it means you have mild decrease in your kidney function. Okay, that means you have 60 to 89%. That's still okay when it is between 60 and 89. Stage 3A and stage 3B. Stage 3A is mild to moderate decrease in kidney function. Now, it means your kidney function is functioning between 45 to 59. Okay? Now it's below 60. Remember what I told you in my previous video? Your kidney function must be functioning above 60 to be classified normal. If you drop below 60, then it's telling you there's a problem. It means you have mild to moderate decrease in kidney function because it has fallen below 60. It must be above 60. You have to keep your kidney function to be in a normal state above 60. Below 60, it means you have a kidney issue. Now, the 3B say mild to moderate decrease in kidney function at 30 and 44. At 30 and 44, from stage 3, stage 4 to stage 5, now it's now progressing from moderate to severe. At this stage, 30 to 45, okay, you are now into severe stage. Okay? because your kidney function is between 30 and 44 milliliter per minute. Then stage 5 is severe decrease in kidney function. If your kidney is functioning at, the GFR is functioning at 15 to 29, definitely you need a kidney transplant. From stage 4, you need a kidney transplant. At stage 5 is kidney failure. At stage 5, which is a kidney failure, your kidney is functioning less than 15%. At stage 4, your kidney is functioning between 15 to 29%. So at stage 4, you need kidney transplant. In stage 5 is kidney failure. So that is why I say there are 5 stages. Okay? And each of these stages have their symptoms. Each of these 5 stages have their symptoms. Okay? But that's not what I'm going to go into explaining in details. So all I have to say is, from that particular video that I saw, Okulore have to prioritize which is the most important ones. Now, from my own calculation and from my own what I saw in that video, okay, is there are 10 people, because I was counting 10 from, I keep changing the video angle, I counted 10 that need urgent care. When I say urgent care, they need kidney transplant. He has to be not only sourcing for funds, not all of them can be on dialysis. Dialysis, some of them can survive on dialysis, like those who are in the early stages of kidney disease. Yes, they have more time. But this group that are in their final stage, stage 4, stage 5, what they need now is kidney transplant to save them. For how long are you going to be paying that money to keep them on dialysis when they are, at the end of the day, they won't live? So, yes, you can put them on dialysis, but you should be soliciting for kidney help from the masses who are going to donate. Because money, kidney dialysis is not going to solve those areas. The ones who are going to benefit from dialysis are those who are in the early stage to moderate stage. They still have more time to be on dialysis. But those ones that I can't do with a swollen stomach, ankles and everything need urgent care. What they need now is kidney transplant donors, those who are going to donate kidney to them to survive. So he has to prioritize the scale of importance. Okay? Because if somebody told him 200 million now, and you say you have 500 people there, that 200 million will last for two months, and that money is finished. And at the end of the day, you might not even save any life, because you didn't prioritize those ones that need that urgent care immediately. Okay? So that is my little advice on this particular issue. I have another video you guys can watch. So I sympathize with those individuals that are battling these terminal conditions. Okay, I sympathize with them, and I hope and I wish them quick recovery, and I hope they get assistance they are seeking for. And I thank this guy for the humanity that he's doing in the society, and I continue to wish him good luck for having that humanity in him to help those individuals. So that's my little contribution to that particular video that I saw, and I hope this is going to help certain people to do the right thing, to make sure we don't have this much. Early annual checkup will help. You have to be preventive, not curative. Make it a point of duty. You can go once in a year, do your complete annual checkup, or twice in a year. So if you're able to see something is wrong with you, at least you know you caught it in the early stages, so that gives you enough options to apply treatment. Okay? So that's what I'm going to say in this particular video, and then hope to see you guys more, and then wishing you guys all the best. Bye-bye.